Hello, my name is Esther Otite, and I'm here today to present to you the disease of my choice, and it's titled colorectal cancer. Slide 1. Definition of colorectal cancer. This is a type of disease, a chronic disease of the digestive system where cancer cells attack the colon, the cecum, and the rectum. Research has shown that more than 93,000 cases cases were identified in the year 2000. Colorectal cancer is the second leading cause of death, of cancer death in the United States. This disease can be detected at an early age, and it can be prevented through screening. My next slide talks about the causes of colorectal cancer. The first big and very important cause of colorectal cancer is changes in DNA. This is where the cells divide, the cells divide through mutation, and the division, the multiplication does not stop, thereby creating bad cells, which are cancerous, and they end up attacking the good cells of the colon. Another cause of colorectal cancer is inherited genetic risks, such as inherited genetic risks. Another cause is familial adenomatous polyps, FAP. Also, personal history of inflammatory bowel disease can also cause colorectal cancer. Obesity is another big one. Bad nutritional practices such as eating fatty foods, alcohol, red meat can cause colorectal cancer, as you can see from the picture above. This is the colon. You have the ascending, the transverse, and the descending. Obesity is another cause of colorectal cancer, because when the BMI is high, that's a big problem. Age also, the more the ages increase, the more risk or the more chances of somebody developing colorectal cancer. The next slide talks about the risk factors. The risk factors, those are the agents that expose or that increase the chances of somebody developing colorectal cancer. One of them is obesity. 2, you have family history of adenomatous polyps, which we talked about before. And then you also have bad diet, drinking of alcohol. Smoking is another big one. Lack of exercise is also one of the risk factors. As one increases in age, there is the increased chance of developing colorectal cancer. And also personal history of colorectal polyps, diabetes, race or ethnicity, socioeconomic status are some of the risk factors. Why is it that socioeconomic status is a big one? Because those who live in low-income environment, they don't have access to a good healthcare. So it is difficult for them to take good care of themselves. My next slide talks about population attributable risk, PAR. Bad dietary practices has a big role in people who develop colorectal cancer. Research has shown that about 12% of colorectal cases has been linked to eating of red meat. That's high consumption of red meat. And also about 14% has been linked to high intake of processed meat. Smoking also accounts for about 80 to 90% chances of developing colorectal cancer. So if enough education is given to the community for them to reduce the intake of red meat consumption, reduce smoking, that will reduce the number of or the rate of death of colorectal cancer to about 80 to 90%. Research has shown that in about 487,000 subjects, about 4,687 was identified or diagnosed with colorectal cancer. Obesity and inactivity that has been part of the causes of colorectal cancer. You see that if people are able to get that education and they know that it is good to be able to involve themselves in about 30 minutes of activities, physical activities per day, starting from moderate to rigorous activity. This will help to reduce the death rate of colorectal cancer and even the development. Gene mutations such as HNPCC related mutations, with screening, we be able to reduce 70 to 80% of gene mutation. Now, my next slide talks about um, relative risk of this disease. With this research, when the calculation of this relative risk function was carried out, you can see that on this graph, there is red meat consumption. You have the males 1.17, females 1.17, and then they intercept at about the male minus 0.157, female minus 1.57, and then unit of change per day. You see the males 20, females 20. Change in risk with each unit change per in prevention to prevent. Males is 0.002, females 0.002, and the same with processed meat. What can public health personnel do to help reduce the risk of colon cancer, risk of developing colon cancer? Screening is a big one. Two programs that public health officials can do to save people or the community is number one, screening. The yearly fecal occult blood test, which is a chemical test that detects the presence of maybe blood in the stool to identify whether there is cancer present in the colon. We help to reduce colorectal cancer death rate by 33%. Diet and supplements. For example, diet high in fiber will help to reduce the development of colorectal cancer in the colon. And also, through public health program, the community can be educated to increase supplemental calcium intake, which help to reduce the development of colon cancer. In screening as well, a comprehensive colonoscopy is ordered. People are made to screen through colonoscopy every 10 years. There is also flexible sigmoidoscopy, um, which help to detect cancer cells in the colon. Up to between 65 to 75% of polyps that could be developed in the colon, and about 40 to 65% of rectal cancer can be detected. I believe that I've been able to present some of the facts about the colorectal cancer. For more references, for more information, the references on the slide will be able to produce more information. Thank you. Bye.